On behalf of the Mayo Clinic, we're delighted that this relationship has now come to fruition and that AIG hospitals are part of the Mayo Clinic Care Network. As Dr. Reddy said, we've been working at this for 18 months or so. It's sometimes seems like a long journey, but we've gotten to know each other very well and delighted that they are part of the network. We have a team of people with us today, and I'm not going to introduce everyone, but I will say that as we move forward with this relationship, we will have a relationship team that will work on a frequent basis with AIG, and that's Mr. Chad Cranebell and Ms. Susan Nist, who's in the front row over here. So they will be here periodically on the phone, on webinars, working closely with AIG. Just a little bit more about the Mayo Clinic. The Mayo Clinic was founded by a surgeon, Dr. Worrell Mayo, and then his two sons created the Mayo Clinic. In 1910, Dr. William Mayo made a statement in a commencement speech that for healthcare to move forward, it would take a union of forces. And that's always been the belief in the Mayo Clinic, is that in order to advance healthcare, it means people, healthcare organizations, physicians collaborating to move the field of healthcare to the next level. And really, now, over 140 years later, that's what the Mayo Clinic Care Network is about. It's joining with other high-quality, data-driven, evidence-based organizations that are philosophically and culturally similar to the Mayo Clinic. When I say that we are culturally similar to AIG and our other members, it means that we are patient-centric organizations. The mantra of the Mayo Clinic is the needs of the patient come first. And everyone, regardless of their position at the Mayo Clinic, can tell you how their job contributes to improving patient care. And clearly, in the course of the last 18 months, we have come to learn that AIG is equally focused on the patient. Just a little bit more about Mayo Clinic. As Dr. Reddy said, we're now about 155 years old. We are the world's largest private, not-for-profit, integrated group practice. We work together in a multidisciplinary approach, one patient at a time, about 5,000 physicians and scientists. We have locations in the states of Minnesota, Arizona, and Florida. Our headquarters are in the relatively small city of Rochester, Minnesota, of only about 100,000, but yet we are able to attract people from all over the world into this rural setting. Our patient care is strengthened by our commitment to research and education. If you look at the logo part of the Mayo Clinic Care Network, the Mayo Clinic logo demonstrates what we call three shields, with the center shield being for patient care, patient at the center of what we do, flanked by research and education that we think are critical for an academic organization, again, the same as AIG. In 2011, we decided to create the Mayo Clinic Care Network, so this effort is now almost 9 years old. We have a total of 45 members or thereabouts, with the majority domestic, but as Dr. Reddy said, we now have, with the joining of AIG, 9 international members. The goal of the Mayo Clinic Care Network is to work together to create these strong, clinically meaningful relationships, encourage engagement between our providers, help with clinical decision-making if and when it's appropriate, and also to share our policies, our processes, and through our healthcare administration, work with AIG and our members when they would like assistance creating a new clinical or administrative initiative, helping them get from the point of concept to the point of operationalizing that effort more quickly and less expensively. One of the things that we do, we think we've done very well through the Mayo Clinic Care Network, is to help benefit patients. People say, well, what's the biggest benefit for patients? I think that the most direct benefit is through our electronic consults or second opinions. So that if a provider at AIG would like a second opinion about a case, a complex case, or if the patient is requesting a second opinion and the provider feels that's appropriate, they can seek a second opinion from any of our 5,000 physicians and scientists, triage to the most appropriate expert. From the standpoint of affordability, that allows the patient to stay locally, to continue working with their trusted provider at AIG, not have to travel, and there is no charge to pass on to the patient for that e-consult. So we think from the standpoint of patient peace of mind, improving patient care and affordability, that this approach has really made a difference. There are a number of tools and services that I won't go into in detail. It would take too much time, but as you've heard mentioned, in addition to the e-consult, we work with our members from a standpoint of healthcare consulting and to drive new initiatives, patient education, physician education, working collaboratively on patient outcome projects, and we hope to do more in research, especially with an organization like AIG that has a strong track record in research and the infrastructure to support it. Finally, I would say that this relationship is not just about Mayo Clinic pushing information to AIG or any of our members. As Dr. Reddy and I have had an opportunity to discuss, there are a number of common areas of focus between our organizations. AIG is on the cutting edge of research in regenerative medicine, stem cell research, and genomics or personalized medicine, and Mayo Clinic is doing the same. But some of our efforts are different. A specific example we talked about earlier today. AIG and stem cell research has a very active protocol in how to create liver cells. I don't believe we're doing that yet. I'm looking at my colleague, Dr. Vega. He says we are?
No.
Oh, we're not.
Right.
But in cardiology, which is my specialty, we're doing something similar where we take skin cells and turn them into active cardiac cells. So we can see down the road that if we share, AIG shares with us their approaches in hepatology or liver disease, we share with them in cardiology and other fields that they are expanding to. This will be a win-win situation. Also, we have, as I said, 44 other members, and there are ways that the members start to connect and learn from each other, and we will be introducing AIG to those members as well. So, in the end, our clinical collaboration is simple, that is putting the needs of the patient first. We look forward to working with AIG and turning this into a long-lasting and deeper relationship. Again, I want to extend our warmest welcome to the Care Network to AIG, and would like to present to Dr. Reddy. I'll ask Lene Barkey to come up and join me, a symbol of the relationship.